Please join me in welcoming Andrew Dreyfus.
I was wondering if I was going to get music from Anyways, it's great to be here, and thank you. Oh, okay. That's better. Thank you, Maureen, and thank you, Kerry, and the whole Chamber board and team for inviting me here today. I had a great conversation before lunch with the mayor. The city of Taunton is a long-standing customer of Blue Cross and a great customer, and I got to hear a lot about some of the exciting, especially economic development work that's going on in the area. I also want to acknowledge a longtime friend and teacher, Senator Mark Pacheco, who I think you all know is really the dean of the legislative delegation from this part of the state. He's played a central role in almost every single healthcare and human services issue that's been before the legislature in the last 20 years, and is just tremendously respected in the healthcare community on Beacon Hill. So Senator Pacheco, it's great to be here with you. Thank you for being here today. I want you to know this is not my first visit to Taunton. I grew up in Massachusetts, and the first time I heard the word Taunton was when my grandfather called my brothers and I down and said, "You got to shovel me out this morning because I got to get down to Taunton." He was a physician, he had some patients he had to see down here, and every time it snowed, we'd be down there shoveling him out so he could come down to Taunton. Then when I worked in state government, I got very involved with what was then the Devon State School, which had been in bad condition, and we spent a lot of money, and Senator Pacheco was part of that to fix it up, and then now I know it's going to be part of a larger redevelopment effort. Then when I worked for the Mass Hospital Association, I was back visiting with Morton Hospital and the leadership there, and actually when I briefly ran the Blue Cross Foundation, we actually gave a grant to Morton Hospital to take one of the clinics in one of the middle schools and open it up in the evening for low-income people in the community to get health care. So Taunton is a place, an important community to me, and it's important to our company. We're proud to be the health carrier, not just for the city of Taunton, but also for the other communities served by this chamber, as well as more than 50 businesses in the Taunton area. So what I'd like to talk to you briefly today is about the most pressing issue facing healthcare today, and I think facing all of you as owners of businesses, and that's the cost of healthcare. And what are we going to do about it? And I actually want to try to persuade you today that we're making some real progress and have gained some real insights into how we can work as a community to control healthcare costs. Before I get there, one word about another issue that we've been working on hard in Massachusetts on the health front, and that's about getting coverage for everyone. So in 2006, we became the first state in the country to pass a law, and Senator Pacheco played a leadership role in this, that essentially guaranteed coverage for everyone. And by 2008 and 2009, 98% of the people who lived in the state had health insurance, and 100% of the kids. The only place in the nation where every child had health insurance, something we should be very proud of. Our law became a model for the national law. Unfortunately, the rollout in Washington and even some recent rollouts here in Massachusetts have been less than perfect. And there's a lot of work that needs to be done to fix what is wrong with those laws, but I think that will be done. And when you look back over the last century and you look at big, important programs that we now take for granted, like Social Security or Medicare, those laws too were complex and took several years to roll out. But neither the national law nor our state law really wrestled with this issue of the affordability of healthcare. And we see this problem of affordability wherever we look. At the state level, healthcare consumes a greater and greater share of the state budget, starving other important programs, whether it's public safety or public education or local aid or infrastructure. At the local level, as the mayor well knows, it's, I'm sure, one of the biggest line items in his budget is health insurance, and although he has just a spectacular health plan to work with, it's a rising cost, and he, like every mayor and city council and board of selectmen, are concerned about it. And then you, as owners of private businesses, you are contending with the rising cost of health insurance you have to provide to your employees. And no one wants the kind of situation we're in today, where sometimes you have to choose between, do I hire a new worker or the rising premiums you may be paying for health care? And so as a community, we need to come together and say, we have to solve this problem. We did that in Massachusetts when we had 10 to 15% of our neighbors and colleagues and friends without health insurance. We came together and solved that problem. Democrats and Republicans, business and labor, hospitals and health plans. We have to solve this affordability problem as well. So I want to suggest to you today that there are 3 things that we have to do as a community to solve the healthcare affordability problem. And I want to give you some promising news that we're well on the way in each of the areas. So the first thing we have to do is we have to change the way we pay for care. Change the way that health plans like ours pay physicians and hospitals like the leaders from Morton Hospital who are here today. The second thing we have to do is we have to change the way we design healthcare coverage to involve patients, consumers, our members in their care. And finally, we need to change the way we support people when they're ill, especially if they're chronically ill, and then do more to keep them healthy. So let me talk briefly about what we're doing in each area. So the first area I mentioned was we have to change the way we're paying for care. So for 100 years in this country, we've had a single way to reimburse in the healthcare system. It's called fee-for-service. If there's a service, the doctor or the hospital sends us a bill, we pay the bill. The more services that are provided, the more we pay, without regard to the quality or the outcome of that. So for example, if a local physician practice, and I know that the Adams practice is right down here, affiliated with Taunton Hospital and right in this industrial park. If a Blue Cross member is a patient at that practice, and let's say they have a chronic illness like diabetes, and the doctors do a great job following up on the care and making sure they get all the tests, and as a result they're kept out of the hospital, we pay them less. If, on the other hand, they don't do their job and they don't follow up and the patient requires an admission to the hospital, we pay them more. If while the person is at the hospital they were to get an infection, we would pay them more again. Now, doesn't that seem backwards to you? Shouldn't we be paying more when the physicians and the hospitals keep our patients healthy, keep them out of the hospital whenever they can? So soon after the state health law passed at Blue Cross, we decided to try to redesign the way we paid for care. And we did what most big businesses would do when they have a big, complicated problem. We hired a consultant. And we asked this consultant to scour the country and find a model of paying for care that would reverse this incentive for more care and instead have an incentive for quality, better care. Well, they wrote a 200-page expensive report that basically said, there is no model. There is nothing out there in the country that we can recommend to you. So we had to invent one. So we actually took a team of physicians and nurses and finance experts and business people and put them in a room. We actually called it the cave. We said, you may not come out of this cave until you design a new healthcare system, and they did. And it took several months, literally. When they came out, we gave them those hats with the lights on it that like miners wear as a present. No rocking chairs, but And the system they came up with was one that would reward physicians and hospitals when they provide better care, that would set a budget, an overall budget for every one of our members, for every one of the patients every year, but with big bonuses for quality. And when it started, the physicians were a little nervous about this. I mean, after all, they had worked in the other system for almost 100 years. But we experimented with a few practices. They were successful. The Harvard Medical School hired some researchers to independently analyze it, and they found that quality was up and costs were down, which is really the holy grail in healthcare. Better care, lower costs. And we took that evidence out to other physicians who began to join us. And within 3 or 4 years, 85% of the primary care physicians and 87% of the specialists in Massachusetts, including those who work here in Taunton, affiliated with Morton Hospital, now accept this form of payment. And the results keep coming in. Quality is getting better and costs are going down. But perhaps equally as important, they're changing the way they deliver care. What do I mean by that? Well, they're thinking, if we're trying to keep people healthy, we're trying to keep people out of the hospital if they don't need to be there, we're going to practice differently. So a hospital north of Boston, one of the big issues was they had a lot of patients who had congestive heart failure. and they were being admitted to the hospital, they were being discharged, and within a week they were back in the hospital again. Well, under our new system of care, they weren't going to be paid for these so-called readmissions. So they hired a nurse, and they started calling those patients every single day. Are you taking your medication? Did you follow up with your doctor in the community? And they went from almost half of the patients being readmitted to none of the patients being readmitted for congestive heart failure. Another practice has been innovating in the field of dermatology. You know, a lot of dermatology visits, according to experts, don't require the dermatologist always being there, and so they're using telemedicine. They're actually putting screens in the primary care physician's office, and if the primary care physician sees something that's suspicious, they can immediately get the dermatologist, not just on the phone, but on the screen to look at the condition. Hospitals are dealing with their lab results differently. Previously, often you were in the hospital and you had some lab tests, and then you were discharged from the hospital and the tests hadn't come back together yet. We were told by one of the senior quality officers at one of the major Boston hospitals, the lab results just sat there. Now they're reaching out and they electronically send every lab result back to the physicians. So we're changing the way, in partnership with physicians and hospitals, we pay for care, and it's improving affordability. So that was the first thing I said we need to do. The second thing we had to do is we had to structure the way we design health benefits differently for our members. You know, some people have said, and some physicians said to us, well, it's fine that you're giving us incentives, and I sat next to one of our local physicians. She didn't say this, but if we had talked long enough, she probably would have. It's fine that you're giving us incentives to keep our patients healthy, but what are you doing for our patients? How are you giving them guidance? And so what we did is we started to change the way we design benefits. Some people have described the existing traditional health benefit system as going to a restaurant with no prices on the menu, and you don't have to pay the bill, because there was no transparency about the cost of care. So instead, we're starting to share costs with patients and ask them to think about the cost of care, and it's important. You know, people with lower back pain often, has anyone in the room ever had lower back pain? Probably, half, 2/3 of the room, especially those who still use an old-fashioned shovel this winter like I do. Often, if you go to the physician, you have lower back pain, they'll order an MRI. A fancy imaging test to see, is there a disc problem? Well, physicians tell us that for standard lower back pain, that's often not recommended. And MRIs cost different prices depending where you are. In a local place down in Taunton, it may cost half of what it would cost to send that same patient for an MRI in Boston. So we're giving this information to patients so they can think about the cost of care. We have a great example of this right here in the local area, Bristol County Savings Bank. And I talked to the leadership of the bank before lunch. They had a very traditional coverage. They just switched with Blue Cross to an HMO with a $1,000 deductible, so putting some of the cost back to the workers, but then funding a health reimbursement account for their workers. They saved 15% on their premium, and their workers are more engaged in their care. But now they have a job and we have a job, which is to educate their workers, our members, about that care. Because we've done surveys and focus groups, and a lot of our members who have these new deductible plans, they don't understand them. They're confusing. And so we're working with our customers like we did with Bristol Savings Bank, where we had an open enrollment season in the fall, health education about the new plan. We had plan educators in their sites, and we've given them a lot of online tools. And Bristol Savings Bank is somewhat of an innovator in this area. Previously, for example, they had a copay differential for radiology for like MRIs, where there was no copayment if they went to the less expensive MRI, but a $100 copayment when they had that same MRI in a more expensive setting. And I'll be interested to hear from the bank in a year or two how those plans are doing. So first, we have to change the way we pay for care. Second, we have to redesign our benefits so that we're creating some incentives for our members to really think about the cost of their care. And finally, we need to focus on helping our members with chronic illness and promoting wellness. So every year, Blue Cross spends $13 billion. That's right, with a B, $13 billion on healthcare in Massachusetts for our almost 3 million members. And half of that money, 50% of the money, covers the services for 5% of our members. So 5% of our members cost 50% of our spending. Now, some of them, yes, you probably think, well, those are the heart transplants, those are the premature infants, those are the major trauma, and that's a little bit of it. But most of those 5% of our members who are so expensive have multiple chronic illnesses. They have diabetes and heart disease. They have cancer and depression. They have asthma and another illness. And we as a community, physicians, hospitals, employers, have to focus in a new way on these patients with chronic illness. And that's what we're doing. So we've been both, again, giving incentives to the physicians to focus on these chronically ill patients, and then using our own nurses to start to reach out to these members and try to help them. So one example, one of our members was a single mother, 2 children, who just got diagnosed with Hodgkin's lymphoma, a form of cancer. She was a sole caregiver, worked full-time, and had a limited support network. But when our nurse called her up, she needed help. Our member needed help, and the nurse talked to her about what to expect from the chemotherapy. It helped her to think about what were the right questions to ask her doctor. And she worked with her to help manage the side effects of her chemo. She helped her find a caregiver for her kids, helped her apply for some public benefits like fuel assistance and food stamps. And finally, she helped her through a stem cell transplant. And now our nurse is working with actually her colleagues at a local hospital to make sure this patient is getting everything she needs. This is an example of a patient with serious illness who we're helping getting it managed and getting it under control. Another example was a 63-year-old man with diabetes who had just had cardiac surgery. Our nurse called him up and found out he wasn't taking his diabetes medication. He wasn't on a beta blocker or a kind of standard medication given his illness. And so we talked him through those. We made sure through his physician's office he had the right prescriptions. And then she started talking both with the member and with his wife. And you know, sometimes in most households, it's actually the woman who makes most health decisions in most households, and you can think about that in your own household and validate whether that's true or not. And so they started talking about nutrition, and the nurse showed the wife some web tools that we have to help manage the diabetes. And now this patient is stable, healthier, and costing the system less money. But we also, so that's for the patients with chronic illness, but we also have to think about the other half of the patients. 5% cause 50% of our spending. The rest we spend on the rest of our population, and there we need to work on wellness. And when I met with the mayor today, we talked about a new program that Blue Cross is doing in partnership with the city of Taunton and Weight Watchers called My Fit Rewards. And so it's a 6-month program. The city is looking to sign up about 50 volunteers who each are going to commit to lose between 10 and I think 20 pounds each. And the program works on the new principles of what are called behavioral economics. How do we motivate people financially to participate in good health? And one of the principles of this behavioral economics is that people will do a lot to avoid feeling like they lost out on something. So we're offering a couple incentives. First, I think there's a gift card to join the program, but more importantly, there's a lottery that's going to happen every month with prizes from $10 to $100. But you only can you find out if you got the prize at the beginning of the month, but you only collect the prize if you've actually lost the desired amount of weight that month. And so you can imagine if someone wins the $100 prize in the first week, they're going to make sure that they lose those 2 pounds or whatever the target is by the end of the month to claim their winnings. So we're using these kind of proven motivators to keep people healthy and help them stay out of the hospital. And I hope next time, Mayor, when I come down here, you know, the city of Taunton will be about 500 pounds lighter as a result. We've also done a similar wellness program with the Mayflower Municipal Healthcare Group which is a consortium of cities and towns in southeastern Mass, from Abington to Wareham, including the fire department and others. This is a 6-week challenge. It's a walking challenge. And we discovered that challenges are really helpful. Well, I have a kind of trick question for you. Do you know what the most expensive piece of medical technology is today? Anyone know? It's not a positron emission tomography machine. It's the physician's pen, right? The physician's pen is your pen. Yeah, she doesn't use a pen. She only types now. It's her fingers typing on the keyboard. Why? Because they're ordering all the tests. Well, the least expensive piece of medical technology is this. This is a $20 pedometer. And using a pedometer that tracks how many steps you take in a day, the calories you've burned, is an incredible motivator. We have contests at Blue Cross between the legal department and the accounting department, between the nurses and the physicians on who's going to get the most steps. And cities and towns are doing this. We did this with 6 cities and towns in the greater Boston area, and it was like high school Thanksgiving football. You know, Arlington against Medford, or, you know, Quincy against Braintree. And it was with the firefighters, and they got very engaged in it. So we're doing that. We're giving incentives for people to make sure they get their screenings. So we believe that if we can combine these 3 ways to save costs, if we can pay differently for healthcare and partner with our physicians and hospitals to give them incentive for quality and outcomes, not just for volume and activity, we know we'll get better results. If we give to our members some incentive to actually engage in their care and think about the cost and the value of the services they're buying with healthcare, making a restaurant menu with prices that they have to contribute something to. And if we both manage those 5% of our members who have chronic illness and then try to lift the health and wellness of the remaining 95% of our members, then that too will improve quality and drive costs down. It's not going to be easy. It's actually going to be harder, Senator, than the hard work we did to get everyone coverage in the state. But working together, step by step, we can do this. We solved the problem of coverage. The nation looked to us for solutions. We can solve the problem on cost and affordability. The nation will look to us there. And it's physicians and hospitals, large and small employers, health plans like ours, and individuals and families working together that will make a difference. It's happening here today in Taunton. It's happening with the city. It's happening at the Savings Bank. It's happening with physicians at Morton Hospital. We can all do it together. Thank you very much.